And tonight we are going to be hearing from Dr. Elizabeth Maloney. And she is a Minnesota family physician. Her current focus is on tick-borne diseases, education, and policy. She began providing comprehensive, evidence-based, accredited continuing medical education courses for physicians in 2007, and she's authored several peer-reviewed papers on Lyme disease. Dr. Maloney also acts as a consultant to government agencies and private organizations. She was an appointed member of the 2021 Federal Advisory Committee, the Tick-Borne Disease Working Group. She has also provided testimony regarding tick-borne diseases to several state legislative committees. Dr. Maloney enjoys speaking to the general public on tick-borne diseases, where she emphasizes the need to consistently use readily available tick-bite prevention strategies. The hallmark of all of her work is that it represents a broad-based and detailed evaluation of the evidence. So let's welcome Dr. Maloney.
Thank you. It's so nice to be here. I've talked to other Master Gardeners groups, and I always love the questions I get, anticipating that you might have some as we go. Wait one slide because I might answer your question. But otherwise, if you can't wait till the end, you can certainly shoot your hand up and I'll take a question. And so I do have a nonprofit organization, mostly so that I can get out and talk to people and provide education for clinicians. Tonight, we're going to talk about Lyme disease. I want to have 4 general categories of topics. So the first is, what is Lyme disease? What's the illness? Who's at risk? How do you actually get Lyme disease? And then what can you do to prevent it? So we can say that Lyme disease is a bacterial infection. It's spread by black-legged, or commonly called deer ticks. The disease has 3 stages, and the symptoms and signs vary from person to person. So here's that bacteria. Did you have dinner? Because this always reminds me of spaghetti. And it's really not just one bacteria, it's a family of bacteria. And they are zoonotic pathogens, which means that they can infect not only humans, but a wide variety of animals. Common is dogs and horses, not so much cats. And when you have a zoonotic pathogen, that means that they're very adaptable to their environment, which they have a lot of survival strategies. So in the US, we are primarily dealing with Borrelia burgdorferi sensu stricto on the top. In Europe, they have these other 2 species, Guerinii and Afzelii. But if we fill out our family tree there of the Borrelia species, there's a whole bunch. Oh, and now there's a new tree that we worry about. Those are relapsing fevers, Borrelia miyamotoi, which we do have here in Minnesota as well, has some similarity to Lyme disease in terms of symptoms. Why does the species matter? Well, depending on what you're infected with, your signs and symptoms might be different. It also might affect your testing. So if you go over to Bavaria and then bring a case of Lyme home to Minnesota, your doctor might have a hard time diagnosing you if they're relying on tests. Also, treatment varies between the different species. Sad to say, but Borrelia burgdorferi appears to be the harder of the species to actually eradicate. So there's 3 stages to Lyme disease: early, late, and persistent. And we're going to go through those. Early, it's localized. Late is it is spread through the skin and other places to the body. And then persistent is when you've been treated but still remain symptomatic. Early disease. If you're going to get Lyme disease and catch it, this is when you want to pick it up. So let's go through these things. We'll just pay attention to the boxes. So usually it begins 2 to 30 days after a bite. Generally, it's 7 to 10 days. And it can show up in many different ways. So some people have no symptoms of early Lyme disease, sad to say, because then they miss that opportunity to be cured. Some people develop the erythema migrans rash, and I have pictures of that rash to show you. Some people do not have the rash, but they develop a flu-like illness, almost like they got influenza in the summer. And then the lucky people get the rash and the flu, and they're lucky because they get diagnosed. So what are those flu-like symptoms? Well, you see them here. It's fevers, chills, just feeling headachy, run down. Many people will complain of muscle and joint pain and a stiff neck. Once in a blue moon, someone will come up with a sore throat. There's not much to see when you have early Lyme disease, so you might have that EM rash that I'll show you a picture of. And then if you have that sore throat, you might have swollen glands in the neck, or you might have even a redness to the back of your mouth. Antibiotics are required. This is not the time to try homeopathy or herbals or other approaches. You really want to eradicate the infection. And so really it's antibiotics. Long ago, I gave a lecture with a physician who was a naturopathic physician, and she even took the position that when you first diagnose someone with Lyme disease, the go-to should be an antibiotic. Blood tests are not recommended at this stage, and I'll talk about that later. So there's the rash of Lyme disease. How many of you expected to see a bullseye? Right, and that's what I'm trying to convince my colleagues of. They have to quit looking just for bullseyes, because most commonly the rash is a solid colored oval. If you have central clearing, it gives you that bullseye look, but that happens in less than 20% of cases. Now, the rash usually starts small and expands, and then it will go away. And in fact, the rash will go away even without antibiotics. And sometimes that fools people into thinking, I don't know what that rash was, but it went away, so I'm okay. More importantly, according to CDC statistics, 30% of patients with Lyme disease never had a rash, or at least a rash that was identified. So that's a problem. So all of these are EM rashes. And so let's just take a look. You can see the bullseye up on the top left, but then moving clockwise, you see kind of a faint rash on that gentleman. Then on the extreme right is a very beefy red rash. Let's see if I can find my pointer. This rash. If I didn't know better, I would call that cellulitis. Why is this important to know that Lyme can look like cellulitis? Because the antibiotic we commonly give for cellulitis won't cure Lyme disease. So if you or a loved one gets diagnosed with cellulitis in the summer here in Minnesota, ask your doctor to prescribe something that would cover Lyme and cellulitis. And so it's things like Septin or Augmentin. Getting back to the rash, it can kind of look like eczema, like behind the knee. It can have a very unusual shape. And in people with more pigmentation, the rash will often look like a bruise. So it's not always easy to say, hey, that's an EM rash. In late disease, the infection can go anywhere. And with that, can I move this mic? Oh, good. There we go. So with that, you're going to get all sorts of symptoms depending on where the infection is. Very common are the infection will come back to the skin, so you'll see multiple rashes. People will have headaches, joint pains, a lot of back pain, and they start to develop lots of nervous system symptoms. So light sensitivity, sound sensitivity. They can get different problems with the nerves that innervate the muscles of their face or control their vision. In this stage, it's very common for people to complain about fatigue and pain. And the pain isn't the pain of a joint pain. It's more of a nerve kind of pain. And the fatigue is not like, boy, I had a busy weekend. It's the young mom who says, I couldn't get out of bed even though the baby was crying. It's profound fatigue. It's debilitating. So I mentioned that can come back to the skin and have multiple EM rashes, and that's what's going on here. Not that someone had more than one tick bite. It's just that the bacteria returned. It can go to the nerve, the facial nerve, and that's it comes off of our brains. And when that happens, half of your face won't work. In areas where there's a lot of Lyme disease, if a child presents with that kind of a presentation where their face isn't working, up to half of the time it's really related to Lyme disease. And then many patients, if they aren't treated, will develop arthritis. Usually it's arthritis in the knees or other large joints, but it can get into the fingers and toes, so it can mimic rheumatoid arthritis. So that makes it kind of tricky. It can cause a form of meningitis. And the tricky part there is when we do the spinal tap, the lumbar puncture, and we look at what's in that fluid, if you have a bacterial meningitis with other types of bacteria, you'll have hundreds of white blood cells in your spinal fluid. In Lyme disease, you might have 10. So it looks like a viral meningitis. And so sometimes people are misdiagnosed with viral meningitis. And it can get into the heart. And the thing we worry about there is that it can disrupt the electrical activity of the heart and cause something called complete heart block. And if you have that, you can actually have sudden death. So in some sad patients, the first presentation of their Lyme disease was death. And so that's why, again, I spend time with my colleagues because I want them to recognize the things that can really cause havoc. Late neurologic disease is really the most difficult one for clinicians to diagnose. And it's because it's so unpredictable. It comes on usually months or years after a tick bite. It causes symptoms that are so widespread and seemingly unrelated. So for instance, it's not unusual for someone to have photophobia, so their vision, they don't like bright lights. They have problems with their gut, so their GI motility might be off, and they might have blood pressure or bladder problems. Now, if you came into a doctor with those kind of symptoms, we might wonder about your mental health, but in reality, those are symptoms of an autonomic nervous system dysfunction. And so Lyme disease can mimic so many other illnesses. And so you can sometimes get people who are diagnosed with MS or ALS or Parkinson's, and really what they had is Lyme disease, which is not to say that all Parkinson's is Lyme, right? No, but it's something to think about if you have someone who you know who has been in areas where they might have picked up Lyme disease, something to at least consider. Because if we treat Lyme, you can get someone's health restored. So the most common problems with the nervous system, it's numbness or tingling, nerve pain, which we call neuropathic pain, and difficulty thinking. So people will say, I couldn't balance my checkbook. I forgot simple words. I got lost all the time. Those are commonly seen in patients with longstanding Lyme disease. And so in any given patient, their symptoms are variable and changing. So they might have a lot of trouble with their eyes and their vision and not so much joint pain. And then a few weeks later, the eyes calm down, but now their joints are hurting and things tend to migrate. There's no specific look amongst Lyme patients. So strep throat after strep throat after strep throat looks pretty much the same. But one Lyme patient after another, they are often very different. And as I mentioned earlier, Lyme can look like other diseases. Now, why did I tell you about the blood tests not being good for early Lyme disease? It's because the blood tests are not looking for the bacteria. We're not culturing that. Like you get a urine culture or a sputum culture or a blood culture. No, what we're looking for are antibodies that our body has made after being exposed to the bacteria. And it can take a long time for you to make antibodies. Certainly, usually we don't see antibodies reliably up until 4 or 6 weeks after a tick bite. So if you come in on day 10 with your EM rash and we do a blood test, you're more likely to be negative than positive. And so that's why in early disease, we don't want people to be tested. There's also in late disease, false negatives and false positives. And so it can be very confusing. What we really want clinicians to do is make a clinical diagnosis based on what you tell them and what your risks were. The most important thing is a negative test result does not rule out Lyme disease. It might make it seem less likely, but it doesn't rule it out. Here are all the diseases, or I should say, many of the diseases that Lyme can look like. And so as you can see, it's a long list to go through. So if you've been sick for a while and you think it might be Lyme disease, you don't have to be diagnosed the first time you get to the doctor. Let them work through and do a careful examination of what's going on. Because the goal isn't to have Lyme disease. The goal is that your doctor will diagnose you correctly so you can get whatever treatment you really need. I'm not going to spend a lot of time on treatment, but here are a few things. It's most effective in early disease. And by that, I mean like 80, 85% of people do well. But there are some people who don't. So about 15, 20% still have symptoms after treatment. We don't know why treatment fails. We don't know if it's that the bacteria is still around or if you've just got lingering damage from when the bacteria was there. We know that in animal models and in a few human cases that there's evidence that the bacteria really did survive antibiotics. But there's really, no one knows what to do. There have been a few trials where retreating people with antibiotics did help, but they were very small, and so they're not definitive. So this remains a very controversial area in Lyme disease. So a few instances, if you are bitten by a tick in Minnesota or Wisconsin, and you should call your doctor immediately, even if it's after hours, because there's an after hours answering service. Because if you're going to do antibiotics after a tick bite, you really need to start it within 48 hours. And what I recommend is that it be a 10-day course. Commonly, people are getting prescribed 2 pills of doxycycline based on a single study, but that study had some flaws. In early disease, if you get treated with 20 days, you should expect to do well. So that's really what you want is 20 days. If you have all sorts of nervous system symptoms, or if you had more than one EM rash, then you should look for longer. And you certainly want to report to your clinician if you're still symptomatic when your treatment ends. Because then what the best course of action is probably to retreat. If you think that you have late or post-treatment Lyme disease, you want to check and find a clinician who deals with this. The Minnesota Lyme Association can give you some guidance there. I'm not treating patients myself any longer, so I'm not a great resource for you. So when we talk about Lyme disease, people often wonder, well, how common is it? Well, it's the most common vector-borne disease in the US, much more common than any mosquito-borne disease. And the risk is much higher than it's believed. So it's kind of like the iceberg. It's not what you see above the water, it's what you see below. The CDC now estimates that we have almost 500,000 cases, new cases of Lyme disease every year in the US. And for some people, it is a serious illness. If they don't get diagnosed with early Lyme disease, or if for some reason they didn't get adequate treatment, they can become disabled. And in a national survey, about 2/3 of the patients who had to cut back on school or work, 25% received disability payments for some time. The average cost is $8,400, and that's because early disease doesn't cost that much to treat. It's a couple doctor's visits and prescription, and then the cost of missing work. But it's those later cases that drive up the costs on average. And the trouble with Lyme disease is that we don't have a lot of doctors treating the complicated cases. Oops, fast on the trigger. So here's an older map of reported cases in the US. And so East Coast and Midwest. But if you let your eye gaze at the map for a little bit, you're going to see that there's all along the coast, in the Gulf Coast, down even in the Houston area, San Francisco, up by Seattle. So there's pockets of Lyme disease, but there's scattered cases throughout the country. How cases are getting reported are changing, and so we won't be able to compare numbers from 2024 to 2020 or 2019. And during COVID, we had a gap in reporting from the different states, and so those years are off. But here in the Midwest, there we go. That's all those colored counties, whether you're in the Minnesota or Wisconsin, those are high-risk counties, and the darker the color, the higher the risk. So people who live in southwestern Minnesota and never stray from their home are probably not at risk of Lyme disease, unless they go vacation, up in Brainerd. And so most of us are at risk for Lyme disease. Where in our state do we get it? Well, just about anywhere. So it can be in golf courses, city parks, campsites, backyards. It doesn't have to be in rural areas. We can get it in the spring. The ticks have been out already, but also in the fall. And especially I worry about the fall hunters because especially if they're in hunting camp, they might not be doing good tick checks. So the people at risk, there are a few categories. But in the center are people who are outdoor enthusiasts, especially if you have a companion animal, because you might be doing everything and then your companion brings the tick into your house. Pet owners of any kind, but especially people with the indoor-outdoor cat, because they'll bring the ticks into your home. In this one, what I'm showing here on the left is as we move housing into woods and we fragment wooded areas, we decrease the large animals that are in an area and we increase the small. And so deer ticks actually prefer mice. That's their principal host. So as we have more and more mice, the people who live in these areas with Bambi in the backyard are at risk. And we also know that there are two main peaks of Lyme disease in terms of age. First is young school-age children, and then it's middle-aged adults. Now that's on average. In the last few years, we've been seeing that these seniors have outpaced the kids. And that might just be a fluke for 2 years, but we'll have to see if that trend continues. So lions and tigers and ticks, oh my, this is what we really have to pay attention to. And this is really at the heart of the talk. So deer ticks spread Lyme disease. They have that distinctive appearance. They have a black cape area or scuttum here in a reddish brown body. And they have 4 life stages. They have the eggs, then they have larva, a nymph, adult male is the smaller, and then the adult female. And that's a centimeter ruler. So you can see that even the nymph is only about a millimeter in size. So very hard to see. For perspective, there's a nymph on a fingernail. Here's the life cycle, and I am not going to go over it in detail, but it's there. So if you watch the video later, you could stop it and see. but we can dumb it down to 4 stages. They live for 2 to 3 years, and they have just 2 opportunities to transmit Lyme disease. So the nymphs and the adult females can transmit to humans. Ticks need moisture, and so that's where you'll find them. They desiccate easily. So they're going to be in long grasses, leaf litter, by fallen logs, or any place mice go, because that's where they're riding. They're getting around via mice. So you'll, in a home, you might find them by a bird bath or by bird feeders. They do not actively seek a host. They just hang out on a blade of grass and hope you pass by. So they don't jump from trees. They don't go far on their own, but they will go long range, very long range, deer and then birds. And so Canada used to say that there was no Lyme in Canada, and someone like, look at the migratory birds, seems to have cases in Canada along their flight path. And then your pets will bring ticks indoors, or people who aren't practicing prevention will bring ticks indoors. I was playing bridge at someone's home, and they had a new puppy, and I was in the city of Forest Lake. And later on, there's a deer tick crawling on my sleeve, and I'm sure it transferred from the puppy that I was petting. But I clearly hadn't thought I was at risk playing bridge. So just to compare ticks, there are 3 ticks that we have in our state. We have a lot of the American dog tick, which everyone calls the wood tick. And you can see that it's got a white scutum. Then we hear it again as the black scutum of the deer tick. And then there are pockets in Minnesota now that have the Lone Star tick. And this tick has a single white dot on its back. So the Lone Star used to be just in the southern US, but it has migrated way up. It's even in Maine. So the ticks are on the move. But I don't want you to use size to distinguish ticks, because when you feed a deer tick, it gets puffs up nice and big, just like a dog tick or a wood tick. So knowing what we just learned, I've got 2 ticks here, top and bottom. Which one do you think is the deer tick? Okay, I've got to vote for the bottom. And yeah, that's right, because if you look closely, we see the white scutum. It's always going to be there. So white is the dog tick. And if you come up here, you'll see the black scutum. I actually had Ramsey County master gardeners who were so kind as to have a plant in the audience. One of their members had a deer tick on her for the talk, which allowed me to demo how to take it off. And so deer ticks can acquire other infections and transmit them. Lucky for us in Minnesota, our ticks have the potential to have any or all of these. The 2 that I want to point out are babesiosis and anaplasmosis, and I'll be doing that in just a moment. But you can see that we even have a Borrelia mayoni, because it was discovered at Mayo Clinic. And then this is a different, it's not a Borrelia, but it was named after Eau Claire, right? And Poisson disease is a viral infection for which we have no treatment. It can be very devastating. Thankfully, we only get a handful of cases of Poisson every year. But when we have the potential for being multiple infections from a single tick bite, it makes everything complicated, because the symptoms of those diseases overlap with the symptoms of Lyme disease. So do you have Lyme disease or do you have anaplasmosis? And then the co-infections can complicate treatment because they might need different antibiotics. And also, we might treat your Lyme disease and yet you look like we didn't touch it at all. And it's because you had an undiagnosed co-infection. And so we have to make sure we know what we're dealing with before we begin therapy. So of the 2, the first one I want you to be aware of is anaplasmosis. It is very common in our state, especially in the central part of the state. It can cause significant illness in the very young and the very old. There have been a few transfusion-related cases. This comes on like gangbusters, chills, headaches, and muscle aches, and I mean profoundly sick. There's usually not a rash associated with it. We do have tests for it. The trouble is it takes time to get the test results back. And so what we really want is if a doctor or any medical person thinks, hey, could this be, they're supposed to start antibiotics for it right away and not wait for a test result to come back. Because if you do have anaplasmosis, within 48 hours of getting on the right antibiotic, which is doxycycline, you should feel much, much better. And so that just to show you that the bacteria hiding inside a white blood cell. Then the other infection I want to bring to your attention is called babesiosis. And it's caused by Babesia microti, primarily here in Minnesota. It's like a Midwest malaria. The symptoms are very similar, and it shouldn't surprise us because it's a red blood cell parasite, and so is malaria. And interestingly, we're finding that some of the treatments for malaria work, but what you will have is fevers and chills and muscle and joint pain. Now, because part of the life cycle involves your spleen getting bigger, people often have anorexia, so they lose their appetite. They might be nauseated and vomit, which is not typical for Lyme or anaplasmosis. And so the only thing we see is if you have a really bad case, you might have a big liver or a big spleen, and you might even have some jaundice. But most often we don't find anything when we examine you. We can find the organism under the microscope. And treatment here is tricky because it is not with antibiotics that we commonly use for others. And they usually now have to be combinations of therapies to clear it. If you have had Babesia, you cannot donate blood to the Red Cross. The length of time that you have to remain out varies, but it's usually 2 years after you're treated and symptom-free. We in Minnesota and other high-risk states, they actually screen the blood for babesiosis. So I hope by now I have scared you sufficiently so that you want to avoid the rash, the arthritis, and that facial nerve palsy. And if you really want to avoid them, then you got to avoid this. You don't want a tick bite. And that is what they look like when they get in. They can really, really bury themselves. And it's not so much that they're burying, but the skin reacts and swells around it. So they can be a little tricky to get out. So when we're doing prevention, we have to think of a 3-legged stool, and you have to have all 3 legs sturdy and solid. Otherwise, the stool is going to tip over. So it's personal protection, property, and pets. For humans, the first thing is don't get bitten by a tick. And if you do, find it and pull it out soon. And then maybe if you need, we'll give you some antibiotics. So limit your exposure. If you're out hiking, maybe avoid the very, very early spring if you can, or the deep fall, because that's when most of the heavy biting season is. Walk in the center of trails. Become a better golfer. So you and while you're in tick habitat, if you have to take a break, don't sit on a fallen log because the mice hang out by the fallen logs. And so highest concentration of ticks are by the fallen logs. Stay in the center of a trail. Dress for success. So you want to cover as much skin as possible because ticks do not bite through clothes, right? So if it's hot and you can't wear long sleeves and long pants, then make sure all of your exposed skin has been treated with a repellent. Now, your clothing should be treated with permethrin. And permethrin can stay on your clothing through washings. You know, the product I happen to use is good for 6 weeks. So being a little absent-minded at times, I just treat it the first of the month during tick season. If you are out in tick habitat, you can and you don't see any ticks on your clothing, strip them off and throw them in the dryer. If the clothes are dry, just put them on high heat for 15 minutes. Any ticks that will be on your clothing will be dead. If the clothing is wet, you need to treat it until like usually an hour. So we want to really make sure that we kill the ticks. The ticks are not affected by going through the washer. They just ride with the tide. But you can put them in, kill them in the dryer. So permethrin is that insecticide. Some of you shook your heads like you knew what it was. So you can get it at camping stores and online. It goes onto clothing, not on people. Once it's dry, it's bonded to the material. I do tell people if you're treating your clothes and you get a little permethrin on your skin, just wash your skin. We use permethrin to treat scabies. And so a little won't be a problem. Just don't drink it. There are clothing manufacturers have permethrin embedded. And that is, they used to say 70 washes. But there's been some studies suggesting that perhaps not quite 70. But I certainly encourage people to treat their tents, their sleeping bags, anything that's going to be out in tick habitat, you can treat it. And you want to use whatever it is you're going to use. So if you like aerosols, you can buy aerosols. It comes sprays and even dips. Dips are really good if you're doing a large item, like a tent or a sleeping bag. And all of those things you can find information for on the web. So when you're going to use a repellent, use something that's been proven to work. So that's DEET and picaridin. If you want to use something more natural, the one that we know is effective is oil of lemon eucalyptus. So other products out there, and they are really, the herbal ones have taken over the shelves in many of the Targets but unless they have oil of lemon eucalyptus, you don't know if they're really going to work. And the other thing is, how often do you have to reapply? Because some of these only are good for a couple hours, and that's a downside. Whereas you get into the DEET and the picaridin, and they're good for hours. You have to do a tick check. And there's my granddaughter, just entirely thrilled with her tick check. And you have to look everywhere. And especially with kids with long hair, one thing you can do is put their hair in a ponytail under a permethrin treated hat. And that way, if you don't examine every inch of their scalp, you can have some reassurance that they didn't get a tick bite. But otherwise, you really have to look everywhere in good light. When you come in from tick habitat, ideally is you would strip off your clothes, they're in the dryer, you're in the shower. Because there's evidence that if you shower within 15 minutes, you can remove a lot of ticks before they're fully attached. And so you can brush them off. And so that really has been proven to work. And again, just a reminder, what you're looking for is small. So if you can have a buddy check your back, that's great. Otherwise, you're going to have to get the hand mirror out and do all those things that we do. When I talk about tick removal, the first thing is to get the ick factor done with. So just ick, and now calm down and just grab a tweezer and just go right to the skin and just pull straight up. And it's a straight, steady motion. If you jerk, you're more likely to lose the head in the skin. And if that happens, it's not a big deal. You don't really need to go digging for it, but just wash everything really well. If you can save that tick, that can be helpful because some clinicians are requiring you to present your tick in order to get your antibiotics. I do not want you to try to put anything on top of that tick before you try to remove it. Every spring I get the school nurse said put liquid soap or this or that, and it often doesn't work, and then it makes it harder to grab the tick with your tweezers. And certainly you don't want to put kerosene, gasoline, or burn it off. And certainly don't kerosene and then burn, as one gentleman told me about. So if you're getting a high risk bite, so that's you took off a tick, and it's not perfectly flat, or you're pretty sure it was there for more than 24 hours, then I would recommend 10 days of doxycycline. The other options, this single dose is not very effective. I've written a couple papers on that, but my colleagues are a little slow to come around. I don't want you to wait and see, because remember, 30% of people don't have anything to see. And so that is, to me, especially for where we live, that's too risky. Whatever you do, you still want to be on the lookout to make sure that 6 weeks down the line that you're feeling fine, that you haven't had any troubles. Because sometimes we give you preventive antibiotics and they still don't prevent. So always pay attention to if your health is changing. Companion animals, it's the same principle. Try to keep your pets out of tick habitat. Good luck. My dog was always in the fields and she did get Lyme disease. You have to do tick checks on your animals. You can use products for them. Do not use dog products on cats. It will kill them, especially permethrin is toxic to cats. You need to do a tick check, and that's really challenging on a dog. I'm not a veterinarian, but here's a slide listing some of the products, but I would recommend that you talk to your veterinarian about what they recommend, because it can depend on what kind of, if you have a water dog, that might change what product you use. For your property, you want it to be friendly to people, but not mice or ticks. And so first you got to clean up the yard, get rid of the wood piles, or at least get them neater. Get rid of leaf litter. The best thing you could do is encourage sunlight in a yard or the areas of your yard where you're going to be. And that's because the sunlight helps dry out the ticks. So as cool as that playground structure looks like, we really need to bring it into the sunlight. And the thing with the tick, or the trouble here, is that the poor person, me, mowing the lawn, is at risk every time I get up against that brush. And so what you want to do is build a border. It doesn't have to be anything elaborate, but it should be gravel or something hard, not something that retains moisture. And just enough so that when you're doing that yard work, that you're not putting yourself in harm's way. Now, you want to remove the things that attract deer and mice. And so you think about the things where mice can hang out. And we know that we really don't want to set up a salad bar for our deer. And so you want to use graze-resistant plants. Now, you should blame the Connecticut master gardeners for this slide, because they're the ones who made these suggestions. And so these are the things that they really have found attract deer. And sadly, everyone's favorite thing, the hosta, is really an attractant. And then they recommended, here are some things you might consider as an alternative. If you are going to use things that attract deer, you just have to be very mindful when you're gardening in those areas. Then probably don't have the hosta near the front door. Landscape insecticides need to be used judiciously. We don't need them everywhere, because we have other things that we want to keep, even though we want to get the ticks, or other things that are beneficial to us. The person who is really the expert is Kirby Stafford, and he wrote the Tick Management Handbook, which is available online. And so what we're going to do is we're going to base our treatments on that tick life cycle. So the first time you're treating, you want an application in the spring when the nymphs are emerging. And then in that same year in the fall, you can get the adults. But then in subsequent years, most of the time, you just need to do a spring application. You don't treat everywhere. You treat the things where you'll find ticks. So it's going to be the wood piles, stone walls, and then that borderland between lawn and brush. I don't want people spraying their yards. That's just unnatural. or unnecessary. So to summarize, Lyme disease is a complex and significant illness. Our local risk is growing, and we are in one of the top 10 states in the country. Prevention really works if you use it. And so as we bid a fond farewell to our female adult tick, you know, she seems to be waving. She's so friendly. If you take nothing away from this talk, I hope that you'll remember an ounce of permethrin is worth a pound of antibiotics. And with that, I'd be happy to take your questions.
Am I correct that in Europe they have vaccines for Lyme disease? I know we have them for pets here.
Europe, I don't think that Europe has a vaccine for Lyme disease. We do have vaccines for pets. And the vaccine story is a long, complicated one, but there had been some people who seemed, if they had already had Lyme, that in some people it triggered a reactivation. And so that was problematic. So when word of that got out, the demand, especially because this was in the East, fell. And so that was withdrawn. A new vaccine is in development. Personally, I really hope to get a vaccine because people being people, we tend to cut corners on our other prevention strategies. So fingers crossed that we get it soon. But you know, my dog had the vaccine every year and she still got Lyme disease. So it's about a 70% protection in dogs. Yes, sir.
Invasive or is it invasive?
Is the deer tick invasive? I think, no, I think it's our natural occurring tick. Do we see more deer tick? I think we do, but I think it's because we're pushing into their habitat. But we do know that other ticks, like the Lone Star tick, we wouldn't call it invasive, but its range has certainly expanded. I mean, and that's what we're seeing all over the country is that the ticks that have been present, they're just pushing out. They're in more places. Yes, ma'am.
I back up to a marsh. So first of all, I'm falling. I like doing this feeling I have on. I back up to a marsh. So a year or so ago, I stood about taking like a toilet paper tube, putting permethrin on cotton balls, stuffing it in there, and the mice take it back to their homes and sleep on it, and it kills the ticks on their body. Is it effective? And then B, if that affects the mouse and then a hawk eats that mouse, is the hawk gonna die?
I think not to the hawk.
No to the hawk. Okay.
Because it's really not killing the mouse either.
Okay.
It's just taking, the tick tube is basically what you're describing. They used to actually market a tick tube. And the trick with those is you need to put them, I think, every 30 feet. And then you have to keep replenishing the supply of permethrin treated cotton. But it's really as simple as just spraying cotton with permethrin and jamming it in a toilet paper roll. Or actually, if you have some PVC piping, because paper will break down with rain.
Does that affect water?
No, that shouldn't affect, don't put it right in the water but there are some of the things that are treated, and that's in Kirby's book, are toxic. You don't want them in the waterway. So that's like, if you have a property that abuts water, you should probably get a professional if you're going to treat it. Yes, sir.
Is the rash always around the tick bite? And is there a time frame when the tick has to be embedded with the transfer?
Oh, thank you for those questions. So yes, I will. So does the rash always occur where the tick bit? And how long does a tick have to be embedded for you to get Lyme disease? Two great questions. So the first is the initial rash is at the bite site. If the bacteria has gotten into the bloodstream and then come back and causing multiple rashes, they won't be at the bite site any longer. How long does a tick need to be embedded before you pick up Lyme disease? We think 24 hours, but there are always cases in the literature where it was under 24 hours. But generally speaking, 24 hours to me is kind of like a risk cutoff. It's not a perfect world, and so we're always balancing the risk of, do I have Lyme disease versus the risk of taking antibiotics? And so I'm pretty comfortable with 24, but if a patient really pushed and wanted it because they had a bite that they were sure was only 16 hours, I wouldn't fight them on it. The other thing that's interesting is they've done studies, and people tend to underestimate the time a tick has been attached, because they can actually take a tick and measure a ratio of that scuttle, that cape, to the body, because the body gets bigger as it fills. And then they can do their calculations and get a pretty good estimate as to how long the tick had really been feeding. And so people tend to underestimate. So unless you're absolutely sure, don't give the doctor a number.
How long does the tick stay on?
If you don't disturb a tick, it usually, how long does a tick, sorry. How long does a tick stay on your body? Undisturbed, it's 3 to 4 days. They're slow feeders, and in their saliva, they have antihistamines, which is why they don't itch. They have painkillers, which is why those tick bites are painless. And they have anti-clotting things so that they can get the blood to pool, and then they're just basically sucking up blood.
There's a chat question about goes the rash itch.
Does the rash of Lyme disease itch? No, it's usually not itchy. If you get a rash within the first 24 hours after a tick bite, that is usually a reaction to the tick saliva, and that will itch. A tick saliva allergic reaction usually goes away within 48 hours. So if it's been 5 days and you still have that there, it's not an allergic reaction. And Lyme rashes can get very large, take up a whole back, but oftentimes they might only be the size of a $50. So there's quite a variation in the size of the rash. Yes, ma'am.
You said that it was one of the biggest issues in the health industry. It's such a big deal. Why are more doctors not treating it? You said not a lot of doctors know how it.
What I meant is, is it a big issue in the health industry? It's the most common vector-borne disease. But in the grand scheme of things, we've got heart disease, diabetes. I mean, things that are unfortunately take more attention, which isn't to say that we can't learn other things as we go. And certainly, being an informed person, you can bring your provider up to speed if you need to.
Yeah, I was curious when you showed the age distribution of cases within humans, there was those 2 peaks. And I was wondering if there's a particular reason for that.
Oh, this is why I love master gardeners. So the question is about the risk based on your age. There were the 2 peaks, the young kids, and then as we get older. And no one has really looked at it, but the Betty Maloney theory is that when you're young, your immune system is still learning. And as we get older, our immune system is losing its strength. And so I think what's going on is like the 20 and 30-year-olds who are out in the world and hiking and doing lives, they have great immune systems. And so I think it would be interesting if someone would really do the research on that, because maybe we could find ways to help the at-risk groups. Yes, sir.
Medical diagnosis getting better. I got a friend here.
Our medical diagnosis is getting better. It's slow. It is slow. And some clinicians are great, and others are a bit more resistant. Because first up, we were taught it's a bullseye rash. And it's arthritis. We weren't taught about all the neurologic symptoms. Carditis has just now gotten on the radar recently. So it just takes time in medicine for information to filter down from research to the doctor's office. But again, that's why I come out to the public, is because then at least you have the opportunity to know and to be your own advocate. Yes, ma'am.
Yes, I am a little confused about, so Lyme disease is adhered to. There are other ticks that you showed us tonight. They all, and are you saying they also carry Lyme disease?
Oh, let me clarify. So the question was about which ticks are causing Lyme disease. No, in the US, the only ticks that transmit Lyme disease to us are the black-legged ticks. And depending where you are in the country, it's a deer tick or a bear tick, but so the black-legged ticks. The other ticks transmit different diseases. Now, a wood tick might bite a mouse and pick up Borrelia burgdorferi, that bacteria that causes Lyme disease, but they might not have the exact ability to transmit it efficiently. The black-legged ticks and Borrelia burgdorferi evolved together, so they have interactions that really help the infection take hold in animals. So you might find Borrelia burgdorferi in a dog tick, but that doesn't mean you could get Lyme disease from a dog tick. So thank you for having me clarify that. But which is to say, those other ticks do transmit other infections. So for Rocky Mountain spotted fever is one we think about, with not with the black-legged tick, but with the dog tick.
So all ticks are there.
Unless you're a chicken. All ticks are bad unless you're a chicken.
Well, almost sounds like you need hazmat suit.
Well, you know, we joke, but I still live on a wooded lot. So it's more of just incorporating prevention into your daily life. Because it's not that hard.
I have a question from the chat. If my dog ate a mouse that has Lyme disease, would the dog get it?
No, if a dog ate a mouse that had Lyme disease, would the dog get it? No, because we don't think the bacteria survives, the stomach, the acids of the stomach. So no. And you're not going to get Lyme disease from eating venison. So don't worry about that. Well, I just want to thank you for your attention. It's really been a treat to be here.
We're listening to drafts. So we're all very quiet.
Well, I'm always happy to help the mood. But really, it's been my pleasure. And certainly if you have questions, maybe Mia can pass them to me via email or something. All right. Thank you.